Hey everyone, just wanted to go over our work for this week to come and just a review of some items from last week. So last week we talked about strategic planning as well as law and policy and ethics and corporate compliance, which kind of incorporates all of those things. So we had our discussion, which is fine, written discussion, and your group case studies. I'm pretty sure most everyone has turned them in, but if you have not turned in your self and peer assessment, please do so. So this is obviously where you did your case study work and submitted the assignment here. The self and peer assessment goes down here in this box. You'll download this, complete it, and then re-upload it to there. So like I said, I think most everyone has done that, but if you have not, please go ahead and do that. So that was last week. This week is a little bit of marketing and a little bit about patient-centered care. So the two kind of end up going hand in hand overall because the healthcare marketplace is very crowded, and we want to do what we can to make our organization more attractive than others. So one of the ways that we can do that is really making sure that we have very patient and family focused care. It's good not only for outcomes, and it's been shown that that's very good for healthcare outcomes, patient outcomes, but it's also good for service. So when you have a very patient-centered focus in your care plan, it makes people happier. It makes the customer or patient in this case feel valued and feel that they're getting value for their money. So patient-centered care is really the wave of the future, and a lot of places have already made that shift. You'll see a lot of physician practices that have moved to being patient-centered medical homes, those types of things. But we'll continue to see that shift. It's harder in the hospital environment to really operate in a patient-centered environment because there's so many patients. So it's hard to focus all of your attention on all of the patients all of the time. But we see in the physician practice realm, it's been fairly easy to make that transition. And then so it's all about, if a patient does have to be hospitalized, how do we leverage the network that already exists around that patient to make sure they're receiving the best care in the hospital. So this week we have a discussion, again, another written discussion board for this week. We do have a reflection paper for the week, kind of thinking about patient-centered care in relation to quality. And some discussion there. So there's document above that you'll read for that. We also have our quiz for this week, and I think that's about it. Let's go over a few of the quiz questions. Before I do these, I do want to again reiterate, I apologize for things being a little laggy over the last few days. As I'd mentioned in my email, my father-in-law passed away, and we're still trying to plan services and stuff, but we're hoping to get that settled, hopefully sometime within the next couple days, and move forward from there. But I do apologize, and please know that if you send me an email or you call, I will get back to you. Depending on what's going on at the time, it may take me a little bit longer than normal, but I will certainly try and get back to you within 24 hours at the absolute latest. And I did get, I think I did get caught up on your class for grading from the prior week, so now I have this past week's grading to get through. So any questions on any of that, please let me know. Okay, sorry about that. I didn't figure you needed to see my little notes from my husband up in the upper right-hand corner, so I turned off the alerts from that conversation. He's unfortunately in Florida, and I am in Pittsburgh, so it's making all of this a lot more difficult. My father-in-law is in New York, so we're kind of all over the place. But so just wanted to go over a couple of questions from the quiz from last week. Generally, people did really well, so there's not a lot to go over. But so first question: which of the following is not a potential barrier to successful execution of a strategic plan? So obviously, the top one would be wrong because in looking at what is the correct answer, we'll realize that not all of these are barriers. A lack of focus on the strategies could be a barrier. Strategies that don't align with the culture could certainly be a barrier. Not enough strategies to implement is not a barrier, and that's because as as it's discussed in the textbook, it's really strategy is all about the organization. So you may have an organization that is focusing on a single strategic initiative. Like maybe the big initiative for the year is to focus on, you know, an emergency room expansion, or they're really focused on moving toward certification as a patient-centered medical home. So you may have just a single strategy that you're implementing as part of your strategic plan. And especially now where we have organizations that are really struggling financially, which is a lot of them across the country, they may only have one or two strategies that they're truly looking to implement that are, because a strategy is typically going to be a new thing or an expansion of a thing, or shifting their, trying to gather more of the market share, shifting their market. So yes, there are certainly organizations like think UPMC who has a strategic plan that is probably volumes and there's tons of strategies. But there are certainly other organizations, small organizations, or those that are dealing with financial issues that may only choose a strategy or two to implement just due to budget issues or just due to the size of the organization and the staff to work on it. So not having enough strategies is not an issue. You can be successful with one strategy or with 10 strategies. And actually, as you get to more and more and more of them, so if you try and build this, voluminous strategic plan with all of these goals, you're more likely to fail because because you'll have so many irons in the fire at a time. So less is more when it comes to strategy a lot of the time. Next one. If an act is legal, it has to be ethical. So the answer here is false. And think about, I'll talk about two different things. So, for example, abortion is legal in this country, generally. So it's legal to have an abortion in this country, and there are some that are outside of the bounds of the laws within various states, but generally it's a legal thing to do. However, there are many that feel that it is unethical to do so. So when you look at the pro-life movement, that's all about banning abortions because they feel that is unethical. So here's something that is fully legal but is unethical. On the flip side, physician-assisted suicide. So physician-assisted suicide is something that is legal in very few states, I think maybe 7 states. And it's very highly governed and whatnot. But here in Pennsylvania, it is not legal. There are many people that feel that is the ethical way for someone to choose to end their life if they have a terminal disease with no hope of recovery. So, and a lot of people liken it to a situation of animals. So, we have pets, and not everybody has pets, but a lot of people have pets. And when we have a pet whose quality of life has gotten to be so bad that they're in a lot of pain, they're suffering, and and there's no hope to help them, a lot of times that animal will be euthanized. And it's seen as merciful so that the animal doesn't have to suffer. However, with humans, we don't take that approach. We do in a few states, but generally, folks that are nearing death and are dealing with difficult conditions like things like respiratory issues where they get to the point where they feel like they're drowning in their own body, or things like cancer where the body is just breaking down at a rapid rate. Those types of situations, there are many people, and again, I'm not taking one side or the other of either of these things, but there are many people in this country that feel that it would be more ethical to allow that person to choose to die on their own terms instead of having to suffer. So abortion is legal, but many deem it unethical, and physician-assisted suicide is generally in this country illegal, but many feel that it is ethical. So just a kind of a couple of items for comparison there. There are plenty of others, and certainly if something's legal, it's not necessarily ethical, and if something is ethical, it's not necessarily legal. So those two things don't really go hand in hand, oddly enough. Which of the following is not part of the definition of healthcare malpractice? So in healthcare malpractice, There is always going to be, so malpractice is generally known as negligence committed by a professional person. So medical malpractice is typically negligence committed by a healthcare organization or a provider individually. So medical malpractice is that negligence of that professional person, or organization. So negligence is obviously part of healthcare malpractice. Recklessness and carelessness are considered negligence. So if you're reckless or careless in your activities, that is considered negligence as well. So that means then, obviously, it is part of malpractice also. A person in the healthcare profession is also part of healthcare malpractice. So if you are a Good Samaritan bystander on the street, maybe you learned CPR many years ago or something, and someone drops on the street in front of you, and you go over and you perform CPR, but the person, they're not a patient because you're not a healthcare person, but the person passes away, that family can't sue you for malpractice. You are not a person in a healthcare profession. Now, an interesting caveat here is most states have what's called a Good Samaritan law. So let's say I'm walking down the street with my husband, who is a healthcare professional, a clinical professional, and someone drops on the street in front of us. If he was to go over and administer aid to that person, he would be protected malpractice-wise, because you're not in the situation where you would be when you're normally practicing. You don't have you don't have anything. You don't have any medication. You don't have any way to listen to a heart or lungs, to monitor electrical activity of the heart, any of those kinds of things. So most states have what's called a Good Samaritan law that protects healthcare professionals that are stepping in as a Good Samaritan, say at an automobile accident or if someone just collapses. So there is some protection there, even for healthcare professionals. However, if they are acting in their role as a healthcare professional in their organization that they work at, they are not protected in that way. One thing that is not part of healthcare malpractice is overpayment. So that's more of a fraud and abuse kind of thing. Now, there are situations where if a hospital does not, let's say a hospital is involved with a case where there was an egregious error, wrong side surgery, something like that. And so the hospital had to, disclose that to the government, because that's part of the whole process. When you have a sentinel event like that, you disclose. Well, it depends on the situation, but you disclose to Joint Commission, or in some instances you disclose to the government or the Department of Health. Depends on what the issue was. In that case, generally, some of the visit or some of the stay would likely be paid by the insurance company, but anything that comes from the wrong side surgery, which is actually going to be the majority of the service, would not be covered by insurance, would not be covered by Medicare or Medicaid, because there are rules in place that say if you mess up, we're not paying for it. And that's a pretty big mess up. So in those instances, if perchance they did submit a bill and didn't disclose on the bill the issue that occurred, they could be paid, which I guess technically might be considered an overpayment. But again, that's really more of a fraud and abuse issue. If they're billing fraudulently, not disclosing that there was a hospital-acquired condition, then that would be fraud, not malpractice. It's the negligence piece on the part of the providers or the organization as a whole that is malpractice. So hopefully that makes sense. And that's it. That's all we have for this week. Like I said, everyone did really well on the quiz this week. So again, if there's any questions, let me know. I will be here and around this week. I'm actually in Pittsburgh, like I said. So I'm available and I'm around. We don't anticipate that my father-in-law's services will be until next week. So next week things might get a little hairy for a day or two, but outside of that, I'll be around. Email, telephone. Just let me know, and I'm happy to help with any questions you have. So that's it, and I will talk to everyone soon. Thanks.